Okay, all right. Assalamualaikum warahmatullahi wabarakatuh and a very good morning. Let's begin our session with Ummul Kitab Al-Fatihah. Bismillahirrahmanirrahim. Innal hamdalillah nahmadu wa nasta'inuhu wa nastahdihi wa nastaghfiruh. Okay, so thank you to Dr. Kala, who's willing to spend some hours, not some hours, hopefully just 1 hour, with us today to discuss about a topic which I think is very interesting and will definitely be helpful to us, to our hospital and to the people of Malaysia, inshallah. So, and thank you for everyone as well for joining us. We have 31 total in 30 now in our participants, and hopefully we'll get more in, and we'll also record the session for us to review later on. So I acknowledge that today is a holiday, and everyone, instead of relaxing, spending your time with your family, but willing to spend around 1 hour with us today to discuss a topic which I think will be very interesting. All right, so Dr. Kala today will be talking to us about, well, Dr. Kala is a PhD student in public health. So she's a public health doctor, and her interest is specifically on breast milk sharing and human milk banking, which I think is very useful to us as well. Okay, all right. So Dr. Kala will be talking to us about her study on the knowledge drivers and barriers to the acceptance of breast milk sharing and human banking among Malaysians. So I think from what she has told me, many of the findings are quite interesting, and I think it's useful for us as well when we are setting up our Halimatul Saadiah Mother's Milk Center. And with that, I pass the floor to Dr. Kala, and then we'll open for Q&A sessions, inshallah. Okay, all right. Dr. Kala. Oh, Dr. Kala. You okay? Hope the internet is okay. We just lost our speaker. Try and get Dr. Kala again. I think. Okay. All right, Dr. Kala, the floor is yours.
Okay, thank you, Dr. Syed. Good morning to everyone. Firstly, let me just introduce myself. My name is Dr. Kala. I'm a public health student, doctorate student, just completed my first year in University Malaya. I completed my master's last year. My interest in public health is mainly on epidemiology, family health, and health policy. So leading to my interest in doing my research, which is on breast milk sharing and human milk bank. I'm a strong advocate of breastfeeding, so this is a very passionate topic for me. I have chosen IIUM to do my professional internship this 1 month to learn more about the planning process of a human milk bank, which is religiously and culturally sensitive to our Islamic country. So first, I would like to thank Dr. Syed and the team for accepting me at IIUM to do my internship and to learn more, which will be helpful for my research for me to produce a paper later on. So I would like to share with you my study so far, what is it all about, and hoping to get feedback to improve my study later on. So So this is my study, which is knowledge drivers and barriers to the acceptance of breast milk sharing and human milk bank among Malaysians. This is actually a mixed method study, but so far I've completed only the quantitative part. We'll be proceeding to the qualitative part next semester onwards. So this will be my outline of presentation today. I will just give a brief introduction, my research objective, the methodology, the results of my quantitative results, my conclusion, and just my reference. So introduction, as it is well known to your respective team as well, that breastfeeding is undeniably the most effective way in ensuring the child's health and well-being, and also is the best source of nutrition for all newborns, especially the vulnerable babies like premature infants, infants with low birth weight, and infants in NICU. Breastfeeding and breast milk sharing has been practiced in many cultures for many centuries. The WHO recommends that all babies to be exclusive breastfed, and the absence of mother's own milk, donor milk, is the next best alternative. So the latest report from WHO has noted that about 800 plus children have been saved yearly, and 800 plus children could have been saved yearly if they were breastfed, and that is a huge number. So we have to find ways to help these children, if not possible to be breastfed by their own mother, to get the benefits of breast milk through another source. And WHO also strongly recommends that low birth weight infants should be given express breast milk from a donor's milk when mother's milk is not available. If cannot, then only we will go down the hierarchy to formula milk. So in this era where breast is trumpeted by the government and blazoned all over by the media, there's about 1 to 5% of women who are physically unable to produce enough milk to feed their babies, either due to lactation failure or perceiving not enough milk, or also maybe a small part of it in maternal death. So compared to formula milk, studies have been proven that donor human milk is associated with lower incidence of severe gut disorder, necrotizing enterocolitis, and other infection during the initial hospital stay. So in Malaysia, why is this important is human milk is donated through a global milk sharing network on Facebook called Human Milk for Human Babies that is actively supported by web users, because the concept of milk kinship and the establishment of a human milk bank is still being debated. So we have two ways of milk sharing, one through the formal and through the informal. The formal is through human milk bank, which is still being debated, and the informal pathway is through the wide use or wide network of breast milk sharing among mothers through either social media or internet. So milk kinship, what is it? It's an Islamic belief that the donor mother and the non-biological nursing infant, as well as the mother's own biological children, develop a kinship or a relationship when milk sharing occurs, which prohibits future marriage between the milk brothers and sisters. Why is this a problem within the Muslim community in establishing the human milk bank? Is because the anonymity and the multiplicity of donors to the milk bank contributes to their reluctance in using the milk from a human milk bank. So what is my problem statement? Why did I choose this topic? Is public knowledge on breast milk sharing has increased since 2010 when online milk sharing network provided virtual spaces for mothers with extra milk or surplus milk to share their milk to mothers in need. However, this practice is not risk-free. A study found 60% of breast milk purchased via the internet was damaged to transportation, and about 45% is unsafe. International organizations like Human Milk Banking Association of North America and EMBA, European Milk Bank Association, do not encourage breast milk sharing outside the certified human milk bank. However, similar research on its safety of this commerce-free breast milk sharing is not available in Malaysia yet to develop the policy or guide our mothers on safe breast milk sharing practice. Besides that, there have been many studies done globally to evaluate the knowledge, attitude, practice, and even perception of women towards breast milk sharing and the establishment of human milk bank. But less is known about this issue among our mothers and our healthcare workers. So the justification why I choose this is one of the major concerns of breast milk sharing is the transmission of infectious diseases through informal milk sharing platform, and feeding infants with unscreened raw human milk could pose a health risk. So my study will provide an insight on the important findings of mothers towards the knowledge, attitude, perception, and acceptance of them towards human milk sharing, We also will be able to explore the acceptance and perception on the establishment of a human milk bank. And this finding, hoping, will recommend a future public health program on safe handling and donor screening of safe breast milk sharing, informing future breast milk sharing studies, and also studying the barrier towards the establishment of a human milk bank. So as I mentioned, my research question is as such, and the objective is to determine the knowledge, attitude, and perception among Malaysians towards breast milk sharing and to explore the acceptance of establishment of human milk bank. So this is a mixed method study where I have a quantitative data collection and a qualitative data collection. So the quantitative data collection part was done as a cross-sectional study design using validated questionnaire, which I have already validated using 5 field experts in public health. The form was distributed via social media and WhatsApp, and my target population were mothers who are pregnant, breastfeeding, or have practiced breastfeeding before, and my study period was about 4 to 5 months. So this was the inclusion criteria of my mother during the quantitative data collection. She was pregnant and lactating mother who were able to speak in Malay or English, who are Malaysians and they have provided consent. And my exclusion criteria were those with language barrier or illiterate participants and non-Malaysians. So my study instrument was adapted from an open access journal and validated as I mentioned before. My content validity index of my study instrument was 0.6 to 1.0, which is the normal range, and my kappa value of my validated questionnaire is as such 0.763 to 1. So my questionnaire is divided into 4 parts, which will include the socio-demographic data, the knowledge and practice of breastfeeding practices, the knowledge, attitude, and perception of breast milk sharing, and the last one will be on human milk bank. So this is the results that I have achieved so far. My sample study population sample size was about 421 participants with 100% response rate, but I got no missing data in my data collected. All the questions were answered. So, but you can see 77.3% of the mothers who answered my question were 35 years and younger and of the Islam community. 75.3% of them have completed a tertiary education. 65.6% were employed. More than half of them have good knowledge on breastfeeding, but majority of them were from the B40 group. That means about 62% of them was household income less than 5,000. This will be inferred later where my discussion will be based that the probability of mothers less than how the income can affect whether the purchasing of formula milk is preferable to breast milk sharing. So when I study on the attitude and behavior of mothers on human milk bank, but less than 50% of them have heard of a human milk bank, but amazingly, about more than half, 61% of them agree to the establishment. Almost majority claim to have a request to reveal the identity of the donor. The mothers would like to know who the donor mother is, but balance 50% of the group are not really interested in the education background or whether the donor should be paid and service charges. This has brought out a percentage of 49 to 51% on both yes and no. So what are the factors that mothers claim to be considered during the establishment of human milk bank is mainly the probability of cross-contamination was their concern. Donor health status, milk storage procedure was one of the highest concern among mothers, and the person in charge when taking care of this operation. So these factors should be considered in the establishment of a human milk bank according to the mothers who answered the questionnaire. So when we see the knowledge and attitude about, sadly, despite the many advocacy by the Kementerian Kesihatan Malaysia and many NGOs and health education that's been going on through antenatal checkup and the nurses giving education to mothers about breastfeeding, about only 51.3% knew the correct definition of breast milk sharing. And the issue that could occur, as I mentioned earlier, was of concern is milk kinship, the chances of getting infected, and infection control study shows that mothers who are willing to be a donor and willing to be a recipient was highest among the known group. So they are willing to be a donor to a known mother and willing to be a recipient from a known recipient. If you compare to unknown donor and unknown recipient, most of them prefer not to share breast milk sharing. As you can see, the green graph on the second and fourth bar chart. So what are the factors that has shown positive association to the establishment of a human milk bank? First, good knowledge on breastfeeding. Mothers with good knowledge of breastfeeding has a high association with the establishment of a human milk bank. Next, the knowledge on infection control. The knowledge if the mother was aware on human milk bank, and also monetary charges, like mothers, whether those mothers donating milk to human milk bank and those service charges that should be applied by human milk bank is highly associated or positively associated with the establishment of a human milk bank. So factors that need to be considered as such: educating the mothers on breastfeeding, addressing infection control, and educating them on safe breast milk sharing, and also monetary charges or service charges. These three factors are highly associated with the positive establishment of a human milk bank. So what I could conclude from my study is my study has found a high prevalence rate of mothers who are willing to share breast milk and accept the establishment of a human milk bank. And this action can be potentially shaped by educating mothers on the benefit of breastfeeding, addressing the issue of milk kinship, developing a clear guideline on infection control to encourage mothers to practice safe breast milk sharing. The knowledge and understanding the rationale of milk kinship will guide healthcare providers as well as stakeholders to develop a plan of action that will increase the confidence and acceptance among Muslim mothers to the establishment of a culturally and religiously abiding human milk bank in Malaysia without compromising their belief or the health benefit of a donor milk. So it's a win-win situation. If we can address their concern and also give their babies the health benefit of donor milk, both side wins. Although paying donor mother may be a driver to the establishment and sustainability of a human milk bank as shown in my results, this action could raise ethical concern and profit motivation, which needs further research before deciding to compensate or to pay donor milk. We do not, in my outcome is I do not want to start a milk sharing business in the future where they could branch out to have a different motivation to sell their human milk bank, which might not have 100% milk contained. If they don't have enough milk, they might top up with water just to reach that particular ounce to be sold to be given to the human milk bank. So this needs further research on how can we come up to encourage or motivate mother besides giving cash. Maybe we could think of another way to encourage or to motivate mothers, different form of compensation besides cash. So this public health communication, as my study of interest is, should be aimed during regular antenatal health checkup. We should encourage mothers on breast milk sharing. Healthcare providers should counsel them on the possibility of breast milk sharing during this follow-up. As we all know, we do take data on breastfeeding. Every follow-up, we do take data whether the child is exclusive breastfed, whether they are on formula feed. But we do not have enough data to ask if the mother actually accepted ibu susuan or the child consume milk from a donor milk. We don't have that data, which should be included in our follow-up, because if we want to bring up a policy to the government, we have to have data to prove to them that breast milk sharing has been occurring in our clinic kesihatan, and we have to come up with policies to bring out safe breast milk sharing practices and to encourage and to educate our public on it. Without data, we cannot move forward to develop a policy. So this study will also guide and build healthy public policy on obtaining informed consent from donors and recipients, to enforce donor screening for safe breast milk sharing, as well create a safe breast milk sharing support group among donor, recipient, the midwife, lactation nurse, and healthcare professionals. So we have to create a group to educate them. There is a group on Facebook, informal milk sharing group on Facebook, but who is monitoring their procedures? Who is monitoring whether the mother is clean? Who is monitoring how much is being what is a transaction that's occurring? We need to have a group which is being educated based on the policy that we hope to bring in the future. So this is my references, and I thank you for paying attention, and I would like to say thank you for giving me this opportunity. I welcome any feedback to help me in this study furthermore, hoping to bring up a public policy on safe breast milk sharing and human milk bank in the future. Thank you.
Okay, all right. So thank you, Dr. Kala. We'll open for Q&A. What we'll do is I'll allow anyone who wants to ask question, ideally to raise your hand first, and then you can unmute lah. But before I open to the public, to everyone to ask question, I have 4 questions which I wanted Kala to answer. So, so the first one, based on your study and on your particular study, and also from your experience with the Facebook milk sharing group, do you think race or religion has any plays any role in terms of barriers for milk sharing? That's the
Actually,
first.
hold on, Dr. Syed. I don't know how to remove this sharing part. Am I still sharing my slide?
Yes.
I'm still sharing.
Yep.
Okay. Let me stop share. Okay. So I am a member of this breastfeeding associated group on Facebook and also breast milk donation group on Facebook. So a religion to mothers who are in need of breast milk, who are desperate in breast milk. I'm not talking about term healthy child. I'm talking about premature infants, mothers of premature infants. When they request for breast milk on this social media, they do not really mention that I prefer a certain race or a religion of a child. They just say, I want a particular ounce. I'm willing to give milk back in return or diapers in return. I'm willing to give anything in return if you could just give me some milk for my child who is refusing formula milk or for my child who is in NICU. Very seldom we find mothers requesting for a particular gender or a particular race.
So gender also is not an issue.
Sometimes the mothers, especially Muslim mothers, they will say, I prefer to have a milk donor from a baby boy to prevent future milk kinship and marriage in the future, to my understanding. So very seldom they'll say, I prefer a mother of baby boy or I prefer a mother of baby girl to donate milk. Usually they'll just tell that they need milk. I am staying here. If you are staying here, can I come and collect those things? And they will just mention what food they take, where, how old is their baby, when was the milk pump. These are the 3 things that the admin of the group insists that we must post. Even I have donated. So these are the things that we must post. We must post when was the milk pump, how old is our baby when we pump the milk, what is our diet, do we smoke, do we take alcohol, do we take pork, or do we certain diet, particular diet, any traditional medication we take, and any vitamin C or lecithin or any medication. That are the things that we have to mention.
Okay, all right. I'll read up my 3 other questions first, and then Kala answer. So the first one you did mention, payment for the donor is payment of financial benefits to the donor is something that is being thought of, being discussed about. And do you know if there's any concern like so first one, is it a financial type of payment? And then you did show to me there are some like they want the donors to receive things like diapers or anything, and then the payment from your study, do they think it should be from the recipient or it should be from the milk bank? That's one thing. Number 2 is, what are the other factors you think are the barriers for milk sharing? And number 3, what are the problems with informal milk sharing? So you did mention about screening, and what are the other problems that you think are problems with informal milk sharing? Okay, so those
Okay.
3 questions first, and then we'll open to the other participants to ask.
Okay, thank you, Dr. Syed. So from my questionnaire, we only talk about monetary charges. We have not mentioned other type of payment or other type of compensation. We did not give that option yet. We only said monetary charges. But if you see on the informal platform, they have other options, how you want to compensate a donor mother. But in my questionnaire, I did not explore that. I did not want to plant the idea of other compensation method into the mothers who are breastfeeding who might practice breast milk sharing in the future. I did not want to plant that idea. So does that answer your first question, Dr. Syed?
Yeah, yes.
Okay, and then the second question, what are the barriers to breast milk sharing besides donor mother screening? I mean, besides donor mother screening, what are the barriers to breast milk sharing, right?
Yeah.
Okay, so besides infection control, knowledge on breastfeeding is another factor that is positively associated as well. So we should educate our mothers first on breastfeeding and its benefits. Then only they will be motivated to get donor milk when they don't have enough milk for their own child. Because if they don't have the knowledge on breastfeeding and the benefits of breast milk, they might just opt to the easier option, which is formula milk. So knowledge on breastfeeding is another barrier that I find. Milk kinship is a barrier as well, but not really a positive outcome finding for my human milk bank. Based on my study population and my study outcome, human milk kinship was not associated with the establishment of human milk bank. It was more of monetary charges, knowledge, and also infection control. These were the factors that were associated. And Dr. Syed, your last question was?
Actually, it's almost the same thing as the second question. So I think it's answered. You've answered both.
Okay, thank you, Dr. Syed.
Fine. Okay, so let's open to the participants. Anyone wants to ask any question? I saw Dr. Taufik. Oh, there are several questions already. Azhar, Dr. Azhar, who's one of our obstetrician, asked a question. Any chance of having a milk kinship registry that is nationwide? That is one thing. And then Dr. Nurul Hikmah asks, what is the higher level of policymakers' perception and understanding towards milk sharing or human milk banking in Malaysia? Do they support this idea like in KKM? If Kala wants to answer that. Yep.
Okay, thank you, Dr. Azhar and Dr. Hikmah. So there, as I mentioned earlier, we do not have data yet to show that mothers are practicing breast milk sharing formally through the government clinic. So if we have data to show them that there has been practice going on, then only we can move on to the next step to open up a registry. The same as other diseases, the same of other part, like even when you mention diabetes or eye problem or mental health registry, if they have data to show certain things are happening at a higher magnitude, then only the government will make into agenda to discuss about it. So there is a chance if we can have more studies on breast milk sharing and human milk bank to show to our politicians that this is happening. We have to have a certain protocol, a certain guideline on how to make our milk sharing or human milk bank accepted by the fatwa or by the National Islamic Council. We have to have data first. So the second question, what is the higher level policymaker? Okay, this is based on my discussion with the National Lactation Council and the Kebahagiaan Nutrisi, Puan Rash Adiba. They are planning on opening a human milk bank and establishing a formal human milk sharing pathway. They are in the plan, but they are having problem to go through to get the religious approval, to get the permission from the religious approval part. So they have the perception it is beneficial. They want to do it, but they're having that barrier to get the religious group approval. but they do support the idea.
You did mention HKL is planning to open one soon, is it?
Informally, yes, this is underground information, but yeah.
Okay, all right. Okay, any other questions?
HKL is planning, Institute Pediatric HKL is planning one to open one soon.
Okay, anyone else wants to ask question? I saw Dr. Roshaidai, Prof. Hamizah, and Taufik. You want to ask question? Yes, Dr. Roshaidai.
Assalamualaikum, Dr. Syed, and a very good morning to Dr. Kala. My name is Dr. Rashida. I'm from Kuliah of Nursing. Thank you so much. I think you have highlighted very important and interesting topic. I have interest actually in human milk sharing as well as in qualitative study. So I have 3 questions here to ask you if you don't mind. The first question is, how actually do you compare the knowledge, attitude, and practice of human milk sharing in Malaysia with other Muslim countries? That's my first question. Can I proceed to second, or should I wait for you to answer first?
I'm sorry, Doctor, I cannot hear your question.
Okay, number 1, I think I'd like to know how do you actually compare between the KAP of human milk sharing in Malaysia with other Muslim countries? Yeah, I mean, is it lower or is it higher, our KAP here?
Based on my study outcome, only about 48.5% of them only have heard, they have the knowledge of a human milk sharing. So we are still lower when compared to countries that already have a widespread use of human milk sharing practice, like America, Brazil. If I'm not mistaken, Brazil has one of the highest, followed by America and Europe countries. We are not as established like them, not as high as them, just about 50% only.
Yeah, it is not surprising if they know more because of the knowledge that they have in their own countries. But I mean, if you're comparing the Muslim countries, whether in Turkey, for example, are there any human milk bank being implemented over there, in Iran, for example? So maybe we can compare our study, because your participants or your respondents, more than 90% are Muslims, right? So maybe it worth to consider other Muslim countries, so that, I mean, the comparison would be more appreciated.
I did compare with Turkey. I did have a correspondence with one of the lecturer from Turkey who conducted the study. Even mothers in Turkey, about 60 to 70%, if I'm not mistaken, according to the researcher, they agree to the establishment of human milk bank. But unfortunately, the human milk bank in Turkey is not functioning yet because of this this milk kinship problem.
Right. Thank you, Dr. Kala. My second question, maybe you want to share with us, how do you actually conduct, because I really want to learn this, how do you actually conduct the random sampling using the online survey? Can you share with us?
Okay, so this is how my academic supervisor taught us, because due to COVID, we could not go face-to-face and collect our data, right? So I blasted the questionnaire through online, to WhatsApp, to social media. And when they return back in Excel, the results will come back to me and I can make it into Excel format. So what I do is I take every second person who answered my question. So randomly, I choose every second person who answered the question in the Excel.
So which means that you exclude the first, the third, the fifth, something like that.
I exclude them.
Even though they already answered your questions?
Yes, even though they already answered my question, because I wanted to do a random sampling. I don't want to answer, because it's random, right? I have to pick it up randomly. So I took the second, fourth, sixth, eighth.
Right, quite a way. I mean, I don't know, sayang kan? The study they already answered.
Yeah, the data, yes, I have about 800 plus, I think. 400 was from questionnaire and about 500 plus was on Excel format, because actually most of my questionnaire came from the group, the breast milk sharing group. So they are very passionate about this. So they were very interested to answer. A lot of mothers were interested in answering that part.
Yeah, I know. Yeah, breastfeeding is always an interesting topic to learn. Okay, my last question. You mentioned in your study that you're going to do mixed method, and you said you're going to conduct the qualitative study after this. So, what actually makes you to decide to conduct the qualitative, and how you link the qualitative study with your current findings or existing findings?
Okay, the next part of my study will be the qualitative part. I will integrate my data from the quantity as I have already analyzed my quantitative part. So the outcome of this will guide my questionnaire for the qualitative part. When I interview the mothers, healthcare professionals and the NGOs, the outcome will guide me to form the questionnaire. Though it will be an open-ended questionnaire and not really a very structured one, it will be more open for their part of opinion. So I opted to do a mixed method is because of that, mainly because of that, because I want to know quantitatively, I know what are the things that I am interested to find out, and qualitatively, what are the things the mothers or the healthcare professionals have their opinion as well, not really guided by what my opinion on breast milk sharing is. Because since the questionnaire was developed and adopted by our team, so it was more to what we thought was important based on our research. So the qualitative part will help me to understand or explore the other end of the recipient, the other end of the participants, the mothers and the healthcare professionals. That's why I choose both sides, so I can get a better idea what is Malaysians' acceptance or what are their perception of breast milk sharing and human milk bank, to get a better idea only, basically.
Right. So you plan to interview mothers and healthcare professionals, yeah?
Yeah, yes.
All right. So thank you so much, Dr. Kala.
Thank
Good
you.
luck.
Okay, all right.
I hope so.
Next is Prof. Hamizah wanted to ask something.
Yes, Prof.
Assalamualaikum and good morning, Kala and
Morning.
everyone. First, congratulations with the interesting data, yeah, and nicely presented. The slide were prepared very nicely, and I could foresee that in future, Kala, Dr. Syed, Dr. Shadai, Dr. Jasmine will be the spokesperson or the champion of breastfeeding, sharing, and milk banking in Malaysia, yeah. And I'm happy that somehow there is a relation with Halimatu Sa'diah Mother's Milk Center, since Kala is here for 4 weeks. So don't forget to mention your experience in Halimatu Sa'diah Mother's Milk Center. That is promotion for us.
I will promote.
Okay. My question is that did you, in your questionnaire, did you include whether they accept mothers, donors who having chronic diseases, hypertension, diabetes, and if the mother are smoking, did you ask in your questionnaire?
You mean, Prof, whether I explore their lifestyle in the
Yes.
social demographic part? Oh, no. We did not explore on their lifestyle yet.
Or if they okay to accept donors with hypertension, diabetes, or any other diseases, or if they are okay to share their milk to, the recipient, as well as
Others
the
with chronic
recipient.
diseases. Okay, I
Not
understand.
included. What about
No,
smoking?
we did not include.
Smoking?
Smoking, yes. Smoking we included.
How do you
Smoking
include
included,
that?
but it was we asked whether they smoked or not, but majority, but 100% of them did not smoke. So I did not put that up as a significant finding, because
Okay.
we assume that
just for your information, in the Glasgow Milk Bank, they exclude those any donors who has smokers in the house. There shouldn't be any household smokers. Kalau husband is smoking, or if the brother or sisters in the house is smoking, they exclude these people. So they're very strict. So it's not only smoking on the donor part only. Yeah? And since I believe you're Hindus, right?
I'm Hindu, yes.
Yeah, yeah. And anything that you want to share on the Hindus religion part about milk sharing and milk bank? I'm sure there isn't, but we have not
Actually, no,
spoken
Prof.
about this. Yeah.
I mean, from
Sure.
actually, no.
You ni
Actually,
religious ke tidak?
I religious, tapi my concern is if you ask me from my experience when we participate in this group, you remember the informal sharing group that I told you on Facebook? Their concern is mainly to save the baby's life. So the other thing was not, religion was not an issue among whoever who discussed in the group. Even as a Hindu myself, if I see a child who has a better chances of survival by me donating milk, I will give the milk irrespective what the outcome is. I also had a mother on Facebook. I was discussing with her on breast milk sharing, and she's a Muslim mother, and she has a premature baby who refused formula milk. So the baby is not taking anything, just on IV feeding, according to the mother. And I did ask her, is religion concern? Do you mind taking milk from me? I'm a Hindu and you are a Muslim. Can you take milk from me? The mother was like, I will do anything to save my baby's life. I'm not particular. I just want to see the baby live. So if you can give me your milk, I'll be very grateful. And there was another mother who even commented like, Doctor, saya lebih risau anak saya akan hidup ke tak hidup. Saya tak boleh fikir panjang sama dia akan kahwin dengan orang ibu susuan, abang susuan dia ke kakak susuan. Saya tak boleh fikir panjang sangat. Saya lebih fikir sama dia, anak saya akan hidup 30 hari ni ke tak hidup 30 hari ni. So their concern of mostly was at that particular moment saving the child's life. They did not think further 20 years down the road, when there is the problem of milk kinship that might exist according to these mothers. But all this I will bring up in my qualitative output later.
I think, I mean, you are right. Any mothers or parents would do anything for the child, for the sake of the child life. And it is us, it's our duty. I mean, as the providers or the milk bank committees, it's our job that to maintain as what the Islamic practice that we need to avoid milk kinship marriage. And these we will see this in 15 or 20 years time. If you don't do anything, there'll be many milk kinship marriage with each others. And I mean, we will be the one to be blamed if we don't take any action. I think this is a big challenge for us. That is one of the challenge for the milk bank issues. Thank you, Kala. Thank you. Yeah.
Okay, all right. Next, Dr. Taufik, you raise your hand. You want to ask any questions?
They are not thinking. They are not thinking right. They just want to save their baby at that time. But we have to think right, and we have to plan properly for them, because we have the knowledge on it. That is why I really think that we should have a proper policy, and like how one of doctors said, to have a registry. We have to do it right because we have the knowledge and we have the time. We are not clouded by desperation in our decision making. We are not clouded by saving our child's life. We are more rationally thinking because we can do it. So we should not bank in mothers saying that tak apalah, kita buat sajalah, because we should not take that as an easy way out and not come up with a proper guideline.
Okay, all right, Dr. Taufik. Yes, you want to ask?
Okay, thank you, Dr. Kala, for sharing your study just now. Actually, some of my questions already asked by Prof. Hamiza just now. To prevent some misunderstanding, may I summarize first? Actually, based on your study, the kinship is one of the important barriers, kan ya? Is it? Yes. We agree on that, but we kindly more take as a challenge rather than a problem, kan? So that's we are doing now in Sasmek, and we try to arrange how to be concern and understand about the milkmanship and so on and so forth. Yeah. Okay, but my question is about the other barrier actually. Yeah. How about the formula feeding? Do you have data on, for example, head-to-head comparison regarding the mother's choices, but why they avoid breast milk sharing? Because as I know, most of mothers, when we ask, when we cannot breastfeed their child, they will choose formula milk. What more with the current situation with current huge promotion of formula milk industry in the world now. I think it is another problem. We have head-to-head comparison about that.
Thank you, Dr. Taufik. Actually, we did not explore why mothers don't practice breast milk sharing. We did not explore that expect yet, because so far our study is whether they have the knowledge on breast milk sharing only. I have not taken data how many mothers who have practiced breast milk sharing. I have not gone to that part of it. My first step now is just know whether they know what is breast milk sharing and are they willing to or not. So I have not explored the second part, whether have they practiced or why they don't practice breast milk sharing. So I don't have data on that part, why they don't practice.
Okay, Dr. Kala, there's two questions in the chat. The first one is from Farih Najiha. So asking, do you accept those with history of COVID positive for milk sharing? So that's one thing. The second one is actually I wanted to ask the same question as well by Dr. Hikmah. So she asked, since you blasted the questionnaire to social media and most respondents were from the milk sharing group, so is there would it not be a biased assessment and not representative of the general population? Because the respondents are already in a milk sharing group, isn't it?
Okay.
Yep.
So I answered Dr. Hikmah's question first.
Yep. Yes.
So I blasted it via social media, WhatsApp, this milk sharing group and breastfeeding group. I agree that most of them, there are many respondents from this milk sharing group, but because I've randomly selected the respondents, every second or every second and fourth respondent, so that reduces the biasness a bit. Because just say 10 people answers from the milk sharing group, not all 10 will come in the Excel format 1, 2, 3, 4, 5, 6. It will not come all 10 from milk sharing group. It depends on who answers at what particular time. So maybe it's just the first and second might come from milk sharing group, third will come from a WhatsApp group, fourth will come from the general Facebook group, fifth will come probably from the friends group who posted in their Facebook group. So that reduces the biasness there, because not all comes from that particular group. That is why I choose the random sampling method. If I've not taken the random sampling method and I just take maybe the first 50 who answers the first 60, that maybe can lead to maybe a certain biasness. But this is because I picked the alternative number, so I don't know who is the person who answered, whether which group they are from. So that will reduce the biasness a bit.
Okay, all right. About COVID, what do you think? Is it a barrier for milk sharing, milk banking?
COVID is a very new thing. I mean, new as since it just past 2 years since it started to storm our world. These past 2 years, so we have not explored. But if you take into guidance by WHO and UNICEF, COVID is not a reason not to breastfeed a child. This is my personal opinion. If the mother is COVID positive in contact, they still can, but with proper SOP and with pasteurization that's going to happen in human milk bank, it should not be a problem. based on WHO and UNICEF, and also my personal opinion, I would accept mothers with COVID positive for milk bank sharing.
Okay, all right. I think that is in line with what WHO advised and what KKM advised as well. So COVID should not be a barrier for breastfeeding and breast milk sharing. It's just that strict SOP should be followed. Okay, so now it's already 8:56. I'm going to allow any one or two last questions. Any participants wants to ask any question to Dr. Kala? Tak ada? No more? Okay, all right. I'm not going to allow to. Then, if no more question, then I'll give Dr. Kala 1 or 2 minutes for you to just give your final statements. What do you think is the hope, and what is the future you think for milk sharing and also milk banking in Malaysia particularly? What do you think is the hope and the future? What do you see in 5-10 years?
Thank you, Dr. Syed. In my personal opinion, milk sharing is gaining its popularity and fame among mothers. The knowledge on benefits of breastfeeding and breast milk is increasing among our public, and if we really explore, people are doing milk sharing but informally. So if we can do like how many people might be doing now, if we can prove to the higher authority that people are doing milk sharing, we have to come up with proper guideline and proper SOP and proper policy on milk sharing. We can move forward to a formal platform, a safer platform, which is human milk bank. I feel there is hope. It's just that we don't have a data to guide our actions. I know data isn't everything. I understand from public health background, being a researcher background, we are data guided, but I'm sure everyone also would agree with me that we cannot bring forward to the parliament, or we cannot bring forward to our kementerian without a proof of data. Without numbers, we cannot move for them to get our resources from them, or to get them working onto it, or even a simple thing as even printing out a poster on breast milk sharing. We have to prove to them, yes, mothers are practicing it. So it's either you be the champion and you make the first step, or mothers are just going to proceed doing it without your guidance. And in the future, who knows what kind of problem that's going to occur, any disease transmission, because we are not monitoring any of this. Is the mother donor disease free or healthy donor or nothing? So we know it, we have the knowledge, we have to make the first step. So there is future, but we have to do something about it. That's my take-home message. So hoping to have more studies in this field, so we can all work together and come up with proper policy to guide or to bring forward this agenda to the Ministry of Health.
Okay, all right. Thank you, Dr. Kala. Thank you to all the participants. I do hope our milk sharing and our milk bank will proceed and be improved. We've had patients before. I've had babies before who we have to keep the baby nil by mouth for several days because we couldn't get a mother's milk. We have mothers who are so stressed that they can't produce any milk. I've had fathers who even had to contact all his work colleagues who can donate milk, and it has been a problem. And Dr. Kala also have seen few of our mothers here, and I think you've had some headaches with some of our mothers, isn't it? So sometimes it's not about they are not trying. Many of them are trying very hard to get milk, but some of them also need a lot of convincing and a lot of help in terms of producing milk. So I think anyway, it's an interesting sharing. It's very interesting. I think we do need to progress from it. I do hope there'll be better networking and better discussion and probably cooperation between us in IIUM and also your team in UM and also the National Lactation Council. And because I do think this is a very important endeavor, and hopefully, inshallah, in the next few years, we'll have more milk banks in Malaysia for our premature babies, our sick babies, inshallah. So I think that's all for today. Thank you everyone for attending. Thank you, Dr. Kala, for sharing. Thank you to all the doctors, nurses, and everyone who asked questions, and all those who participated in our session today. I think that's all. Let's end our session with Tasbih Kafarah and Surah Al-As. Assalamualaikum warahmatullahi wabarakatuh, and good morning, and let's continue our rounds for those who are on call today. All right, okay. Goodbye. Assalamualaikum.
Okay, bye everyone. Thank you. Selamat Raya.